These health organization officials say that the lessons given to the people that are being prepared to join medical treatment profession were based on the Ministry of Education publications, without working with hospitals, and this was a challenge to the students because there were no chances of doing internships in hospitals as well as health centers because of the fact that there were no prepared budget for it. It was like business in the Ministry of Education. They couldn't understand that there are the people we needed in the country that are coming to solve the problem. The Ministry of Health will be having these in its responsibilities. In these levels, we need nurses and midwives. We want them to study these years. Maybe it is financial problem. It will be solved. A profession is something that you learn in class, but when you come back, you go in hospitals or in health centers to practice what you learned. And you find that doing coordination seems like it is not the Ministry of Health responsibility, where they give all the responsibilities to the Ministry of Education. Expedite transfer of the mandate for medical training from the Ministry of Education to the Ministry of Health is one of the resolutions adopted by the 17th National Leadership Retreat. The Minister of Education, Dr. Eugene Mutimura, said that this is a solution because of the fact that this will help in working hand in hand with the Ministry of Health in training medical students. If it is teachers that teach those students, they will keep on teaching them. But there will be an additional medical teachers from the Ministry of Health in order to expand the number of medical teachers, as well as expanding the hospitals. We will work with public authorities to put this in action in order to enhance the medical teaching level as we wish. Through University of Rwanda, the Ministry of Education was in charge of preparing medical-based publications, and those that complete their classes would sit for examination prepared by health organizations, all being certified, as well as being accepted in medical professions, either in health centers and hospitals.